Afternoon, everyone. Welcome. I'm Avital Habusha. I'm the Vice President of Programs here at the NYHealth Foundation. Thank you so much for joining us today to discuss how we can keep New Yorkers covered with their health insurance as pandemic-era policies wind down. Before we get started, I just wanted to put out a few housekeeping items. We will be recording this webinar, and we'll be sending a recap link to the recording and other materials after the event. Video and audio are disabled for all of the attendees, but we invite you to chat with us throughout the event to share your questions. We will have a presentation and discussion, and then we'll be making sure to address those questions towards the end. We also do have a closed captioning feature available, which you can access at the bottom of your screen. And so just to set the stage a bit before we get started, as all of you know who are joining us today, insurance coverage rates in New York are now at a record high, with more than 9 million New Yorkers enrolled in public coverage. And we're convening today just a day before the end of the official federal pandemic public health emergency. Many pandemic era policies and flexibilities are set to expire at the same time this month. And last month in April, the continuous coverage requirement that prohibited states from terminating Medicaid enrollees coverage also sunsetted. So as of April, New York is resuming the process of reassessing eligibility and renewing coverage for everyone. So we have a really great turnout today, which I think is reflective of the collective action that's needed. It really is an all hands on deck moment. We all know that broad insurance coverage is a condition of healthy communities and healthy people. And while the state and the Assister and Navigator network that we'll hear from today are working tirelessly, many of you are among them. Many of you also joining us today can help amplify the messages for our patients, our clients, communities, and residents. And so we're hoping to share some of those tools and information with you. So we're going to hear from the State Department of Health about their extensive planning and outreach efforts, as well as the state-funded Navigator and facilitated enroller network about their outreach efforts. And I'm going to turn it to our panelists for some brief presentations about what we need to know about some of the state of play. And then we'll leave some time at the end of the session for questions. I'll be monitoring the chat. We'll do our best to get through those questions. We do have a lot of participants, so it might be that we have to share some of those questions after the session. But I hope that this will give you a good grounding to move forward. So I'm happy today to be joined by an excellent group of panelists who have been close partners of us at the foundation. So first we have Danielle Holohan, who's the Executive Director of the New York State of Health Marketplace, Marcy Goldstein, who's the Director of Communications for the New York State of Health Marketplace, Sarah Santini, who's a Program Specialist and Contract Coordinator with the Community Service Society, overseeing a Keep New York Covered initiative, which you'll hear more about, and Juan Carlos Grajeda, who's the Bilingual Program Manager at Emerald Isle Immigration Center, doing a lot of that outreach work on the ground. So I'm going to turn it over first to our state partners for a brief presentation. I'll be sharing my screen, so if everyone can just bear with me for a moment, I'm going to get those slides up.
Great. Thanks, Avital, and thanks everyone for joining. I'll just make a few comments as Avital is pulling up the slides to say how excited we are to be joining you and how committed we are to this effort. What you'll hear from us, Marcy and I are going to share this presentation, is our commitment to keeping New Yorkers covered and all the efforts that have gone into preparing for this unwind that is underway at long last. And so, but overarching all of it is the desire to keep New Yorkers covered. We are thrilled by the all-time high coverage levels in New York. So we've made a lot of efforts to focus on administrative renewal wherever possible, and you'll hear that through our remarks. Marcy is going to walk through the extensive communication efforts that are underway. And we would really encourage all of you to help us extend our reach. As Avital said, this is an all hands on deck effort. We all want to keep people covered. And so use all your contacts in your communities and help us spread the word about what consumers need to do and where they can go for help. So if we could go to the next slide, we have a number of slides we're going to walk through quickly, but if you have questions, please put them in the chat and we'll focus on the details in the Q&A. So just by way of reminder, Avital laid this out, but the continuous coverage requirements that have been in effect since March of 2020 have resulted in significant increases in coverage in New York. Federally, we were required, nobody could lose their Medicaid coverage during the pandemic. New York elected to extend these continuous coverage rules to our Essential Plan and our Child Health Plus program as well. And we have seen significant increases in coverage. The continuous coverage requirements ended, as Avital said, at the end of March. And so we are in the unwind period now. We do flag the way we are doing this in New York. The first group to redetermine coverage, their coverage ends at the end of June. So no one in New York will be disenrolled before July. And, again, we'll talk about all of the efforts we're doing to make sure people move to the right program, but we just wanted you to know there's a lot of dates, but that one is an important one too. Okay, so the next slide is just a summary of what coverage gains have looked like in New York since March of 2020. We started with coverage across the three programs we're focused on: Medicaid, Essential Plan, and CHIP, with 7.3 million enrollees. And as of January 2023, that had climbed to 9.3 million. So we added 2 million lives over the course of the emergency, and we are now covering around half of the state's population in these programs. So that's a huge number, and it is important that we do this right with the unwind. So the next slide, I'm not going to run through all of this. There's been a number of federal guidance documents that our team has been pouring through to prepare our unwind plans. A few things that I'll just call out. The federal government encourages states to spread their caseloads, not to redetermine more than 1/9 of your caseload in any given month. As we'll talk about in a minute, New York is going further than that and using our full 12 months. Everybody must be given the opportunity for a full renewal before their coverage can be redetermined. And then the 14-month here talks about 2 months leading up to the first redetermination date, and then the full 12 months. I'll walk through a timeline slide in a minute, but we have at most 14 months, and New York is taking those 14 months. The next slide, we want to walk through some of the challenges. I mean, clearly we've talked about the numbers. We talked about 9 million enrollees across these programs. 1 million individuals we are able to auto redetermine for the fact that they are enrolled in cash assistance. We could administratively renew them right off the top, and that brings the number down to 8 million that will need to be redetermined. So those numbers split out across programs. Most are in Medicaid and Child Health Plus. 6.9 million of our 8 million, and a little over 1 million are enrolled in Essential Plan. We also think about the volume of enrollees in two ways. One, is the 2 million people that came in during the course of the pandemic. They're new to us. They're new to a redetermination process with New York's program, so they will require a certain kind of communication effort. And then the other group, of course, have not had to redetermine their eligibility in 3 years. So we're trying to get attention to consumers that they do need to come back now and renew. So those are some of the challenges around volume and the different types of consumers. Some of the things just to highlight here on what we have been doing to prepare. There has been a lot underway, but first is on our IT systems. We've had to update the rules within our systems, and we have an amazing team working on this and resuming the rules the way they were pre-pandemic. So that has been a big body of work. The second is around staffing. Our customer service center and of course the local district offices have had reductions in staff during the pandemic as everybody's coverage was automatically extended. Volumes of staff went down, but we're now staffing back up again to prepare for this activity. And then of course we're restarting our consumer notifications. And then last, Marcy will focus here, there has been a robust public education and outreach campaign underway. So that's what we've been up to. The next slide is just a breakout and a reminder around how our Medicaid program distributes. So we operate in 3 IT systems for the Medicaid program in New York State. The bulk of enrollees are in New York State of Health, which is the most modern IT system. It's, as you know, established with the ACA. And we have 5.3 million Medicaid enrollees through New York State of Health. The other 2.4 million are enrolled through the local district social services offices. That's both New York City and rest of state. And they operate in the welfare management system, which is a legacy IT system. There's 2.4 million members enrolled in the local district social services offices. And the point I made earlier about the 1 million or a little over a million who have cash assistance, they can be automatically redetermined. They are all in the local district bucket. So the next slide is a further breakout of the local district office, how it distributes New York City and rest of state. So 750,000 are in the city and the other 570,000 in upstate or rest of state. The next slide is a few points about our resumption of renewals. So as I mentioned, even though we operate in 3 systems and our timelines are a little different across the 3 systems, we are aligning on the first renewal date for consumers across any of the systems are people with a June 30th coverage end date. And so the timelines differ, as I mentioned. New York City began sending their renewal notices in March. The upstate districts in April, and New York State of Health just this week began sending our renewal notices. And we will take each cohort 1 month at a time. But for now, we're focused on the June 30th coverage end dates. We have 14 months, as I said, to complete the renewals across all of these systems. And another point I want to make, we as an integrated marketplace in New York operating across all of the programs, we are familiar with doing renewals and transitioning people into other programs. And so that is, I think, positions New York well to do that here. And we'll probably see more transitions than we normally do, but we will transition people when we redetermine their eligibility and learn that they're no longer eligible for Medicaid, for example. We'll move them into the program in which they are now eligible. And the part about doing this in renewal cycles to spread the volume, given what we're dealing with, we felt like this was, first of all, the most consumer friendly, but also helps us to manage the volume to keep everybody in their regular renewal cycles. So as I mentioned, the first one is the June 30th, and we'll take it each month. Each month we'll have a new renewal cycle. Next slide, I want to make a few points here around addresses. So the renewal notices across all of the systems will be mailed to consumers who elect paper notices using the address that we currently have on file. And this has been a huge area of activity as we've been preparing for the unwind. Our enrollment assisters, I know plans and others, and our ad campaign, as Marcy will describe, have really been focused on getting people to update their contact information. And this is why it is so important. We want to be able to reach people so that we can redetermine them. So that, would ask you all to spread that message as well. If there's one thing people can be doing now to prepare, it is to make sure that we have their updated contact information, no matter what system they're in. The renewal notices will tell consumers any action they need to take to renew their coverage, and we will tell them the deadline by which they need to do it. Enrollees will have at least 30 days to respond to these notices. And we include some details about how things look a little different across the 3 systems and where people can find this information. So for example, the New York City Access HRA portal is where a consumer can go to see their coverage end date. We're not trying to alarm somebody who might not have to renew for many months. We want people to know where they can go to see what their renewal date is. So in HRA, that's where you can go. The rest of state or upstate districts will be able to upload their renewals through a new mobile app and we have the link here on the slide. And then, of course, for New York State of Health, consumers will renew their coverage through their New York State of Health accounts. And they can also come in and see their coverage end dates online through their account as well. So this timeline that I mentioned is laid out here on the next slide. As I mentioned, across the 3 systems, the first renewal date are the June 30th. And we just wanted to show this in picture form, how this is looking. But so starting with that coverage end date, the renewal notices from HRA in New York City have been sent out since mid-March is when those began going out. The rest of state or upstate renewal notices started going out in mid-April, and New York State of Health, our renewal notices for that June 30th cohort started going out just this week, and they'll continue to go out over the next couple of days. So that will repeat as we move through this 12-month unwind period. We'll move to the July cohort, and everything shifts by a month. And that will take us through to the end of the unwind period, which is May of 2024. Okay, a couple points here. This is a really important slide. Credit goes to Lisa Sprana and her team, working very closely with Sonia Shaker and many others on our team to secure flexibilities needed. And I mentioned at the top about our focus on administrative renewal wherever possible. So on the New York State of Health side, we have received permission around several flexibilities that I'll call out. The first came early. We actually were permitted in last open enrollment to do this for the QHP population to administratively renew people who had already provided consent at application, to use that consent to administratively redetermine their eligibility at renewal. And we saw a significant uptick in our ability to administratively renew people with that flexibility, and that will extend to all the programs now in the unwind. So that was the first. The next set of 4 bullets here walk through a series of what we refer to as E14 waivers that CMS has granted. The first is on the New York State of Health side. There is permission to administratively renew consumers in CHIP and the Essential Plan on the basis of their SNAP eligibility. So that is the first. The second is what is referred to as the zero income flexibility. Consumers who attest to having no income, and when we check our data sources and we can't disprove that point, there's nothing to disprove it, we can take that attestation and administratively redetermine somebody based on that attested income into Medicaid, CHIP, and the Essential Plan. We also have permission to maintain enrollment for consumers who are over age 65 and dually eligible in New York State of Health. That is something that during the pandemic, we were able to keep individuals after they aged out. You know, typically pre-pandemic, we would have moved them out into the districts, but we have permission to keep them within New York State of Health. And that was done so that we got a waiver for resource tests, which would otherwise apply, and the way the budgeting would normally work outside of New York State of Health. So that is a very positive flexibility. And then the last one here, on both the New York State of Health and outside, there's flexibility granted to allow the plans and on the district side, the enrollment brokers and plans to accept updated member contact information without us having to separately validate that information. So that's very helpful given how much we know people have moved over the last few years. On the district side, there's some additional flexibilities that were granted. The first is around administrative or auto renewal for the non-MAGI population with Social Security income. The second is around SNAP for the non-MAGI Medicaid population. There's permission to disregard income from 138 to 200% of poverty for consumers who have SNAP and are in the non-MAGI bucket. I mentioned the waiver of the resource test for the non-MAGI Medicaid population, the updated contact information, and then the last one to mention on fair hearings is the ability for consumers who submit a timely request for a fair hearing in order to help us if the caseloads get large. We will automatically continue somebody's eligibility as we continue to process those. So a lot of work went into these, but the message to take away is that any flexibility that could be secured to help ease this redetermination process. We sought for and we received. So this will help enormously. I'm going to make a few more points and then I'm going to turn it to Marcy. We are doing a lot, and this is, Sonia and her team leading this effort on the tracking and measurement side. There's a lot of tracking of data and reporting to the federal government. The first was a baseline report on where we start the unwind, what does enrollment look like, and then we'll be updating that on a monthly basis to see how it's going cohort by cohort. Things that we'll be reporting is the share that renew, how the transitions between programs look, and monitoring on the volume of our appeals, eligibility appeals. On the New York State of Health side, there are a number of dashboards that will allow us to monitor this in real time. Some of the things that we will look at are how consumers in each of those renewal cohorts distribute across manual and administrative renewal. So we know where to focus our attention on the manual renewal population. We're also going to be looking at a number of demographic details to see if there's anything that stands out about a demographic group that is less likely to be renewing, so that we can focus our energies there. We will also be monitoring program transitions, and we'll be looking at undeliverable mail. So these dashboards really allow us to hone in and identify where there might be issues and where we need to start deploying effort. The next slide is just a visual of what these dashboards look like. This is fake data, but it'll be populated with real data so we can monitor these things. I will move quickly because I want to give time for Marcy, just to make a point about the role of assisters. I think we have a number of enrollment assisters joining us today. We have over 7,000 enrollment assisters participating in our programs across the navigators, certified application counselors, marketplace facilitated enrollers, and they are critical to this effort. More than 3/4 of enrollees work with an enrollment assister. This is a very important channel for us and have direct communication and trust of consumers in the community. We and Gabrielle Armenia and team have been working to make sure that they have resources that they need. The team conducted 2 rounds of training around the unwind activities, and these are posted to our website. But among the resources that will be made available are lists, that look at some of these details around administrative versus manual renewal and things that I walked through a minute ago to focus on, which consumers needs attention and more assistance. And I think I mentioned the training. So I just want to say there's a lot out there for enrollment assisters, and they will continue to be a very important channel. All right, I'm going to stop talking and let Marcy jump in on all the wonderful communications work. Thanks.
Thank you, Danielle. And thank you, everybody, for joining us to hear about the important work that we've been doing and continue to do. To complement all of the hard work that Danielle and team have been able to do, we are trying to promote all of that through all of you, through our partners statewide, to share the information, most importantly, with consumers, with Medicaid members, about the fact that renewals will be happening, and they need to pay attention to make sure that they do this. They take action when they're receiving notices to take action, so they don't have a gap in coverage, and certainly so they don't renew their coverage. So over a year now, we've been working on outreach, marketing, and education campaign to inform New Yorkers enrolled in Medicaid, Child Health Plus, and the Essential Plan about these steps that they need to take to make sure that they keep their coverage. It's a several-pronged approach: public education campaign, paid advertising, and direct mailings and other communications tools that we will show you in just a few minutes. We're also working closely with local departments of social services statewide to share educational materials, videos, digital assets to support their districts and to help share with their consumers as well. So the public education, the public education campaign reminds New Yorkers about what they need to do to renew their insurance coverage. We have a campaign webpage which is really consumer focused. You see the link here, and I'm sure Avital and team will be sharing these with you all, so you'll have access to these links. We needed a place to actually have consumers go. So when we put ads out, whether they're display ads or whether they're social media ads, and it says, for more information, click here, find out how you need to renew, click here. It takes them to this page, which is really, we've created like a one-stop place of shop of resources that they need. It talks about in the earlier days, the importance of opting in for text messaging. And now it talks about what they need to do once they receive that notice to renew and how to go through that. We have several tutorial videos and things that we'll go through. And the information is available in all of the following languages. So this is a screenshot of what that homepage looks like when a consumer goes there. And you'll see it's information for New York State of Health consumers, those who've enrolled through HRA, those who enrolled through the LDSS, frequently asked questions, and then you see learn about steps to renew your health insurance. And it actually takes the consumer step by step through the process in a very easy and animated way, if you will, which we'll show you in a few minutes. And this is also featured on our New York State Medicaid website. Majority of our consumers who are enrolled in Medicaid do enroll through New York State of Health, but obviously many do not and may not recognize the New York State of Health brand, although they should. But those who don't, we have everything available on our New York State Medicaid website as well. It just looks a little different, but all the information is the same. And then our communications toolkit, which is the toolkit that's for partners, for all of you. And it features, this is just a snapshot. There's many more things. It's constantly being updated daily these days. And it features social media posts that are ready to go, language written with images, text alert information, drop-in articles and email messages that are already crafted and ready to be customized, fact sheets that could be co-branded, FAQs, which you saw, and all of these things. I won't go through them every single one, but this is just a snapshot for all of you of what you could use in all of the following languages. And here is an example of the process. This is what we're calling our consumer journey. And this is for New York State of Health, and we use the character name Michelle. And it takes everybody through a step-by-step, 5-step process as to how Michelle renews her health insurance coverage once she receives her renewal notice. We have this available for those who enroll through their LDSS and also those who enroll through HRA. And this is another screenshot of our PHE toolkit. Excuse me. And this it starts with an overview, and it has snapshot of our ads that we first started back in February of 2022 now. And throughout last summer, Stay Connected ads that you see, and we have new ads that we are now just released that we will show you in a minute. So this new campaign that we just launched at the end of April, what we've called internally, if you will, is our third phase of our ad campaign. And this is the part where we're telling people that they need to renew. If you hear from us, it's time to take action. Your renewal notice is one notification you don't want to miss. It's your signal that it's time to go. It's time for you to renew. And most importantly, we're here to help. And this is a sample of our new ads. This is one message you don't want to ignore. And it looks like a message that you would receive as a text message. And this is an example of a print ad on the left, a social media ad on the right, and a display ad as well. We launched our digital ad campaign at the end of April, the beginning of May. The first week we launched our television and broadcast ads. And next week we will be launching our out-of-home ads on the New York City subways. And this is just another sample. I mentioned that we have a lot of tutorial videos that are available in that consumer COVID-19 pages. And this is just an example of one of how to update your contact information. We have others about how to find your enrollment end date and so on. So lots of really great information. And happy to share all of this with you all.
Great. Thanks, Marcy. So I think we'll pass it off to Sarah to tell us a little bit about what's happening with the Navigator and a sister network, and then to Juan to give some examples from the ground.
Thank you, Avital. Good afternoon, everyone. I'm very excited to be here with you all, and thank you to the foundation for having us today. I'm Sara Santini, and I work with the Keep New York Covered project over at the Community Service Society of New York. Next slide, please. So the Community Service Society, it's a 180-year-old not-for-profit working to promote economic opportunity for New Yorkers. And we do this by centering our efforts on the voices and experiences of low-income communities and communities of color across the state. Our organization has numerous departments. We're part of the Health Initiatives team, where we provide health consumer assistance. We provide this assistance to over 100,000 New Yorkers annually through a live answer helpline, and in partnership also with trusted local community-based organizations, CBOs. Our department has numerous programs, one of them being the Navigator program, which operates in 52 counties with 17 CBOs. We also have the facilitated enrollment program for the aged, blind, and disabled, serving 38 counties with 8 CBOs. And we also have 3 ombuds programs that help patients with post-enrollment barriers, such as like access to care, medical billing, navigating the healthcare system, and appeal denials of care. Next slide, please. So I just want to highlight the importance of sisters. Danielle mentioned it in her slide deck. Sisters, they're really instrumental when it comes to enrolling in health insurance. The state has invested in local community-based enrollment assisters who educate New Yorkers on their health insurance options, help them enroll into coverage, and assist them through the renewal process. Assisters, they reach the hard-to-reach populations, and they speak the languages of their members. Many of them might live in the communities they're serving. They might be recruited from there. So these are trusted resources that clients will listen to and work with, which is why many clients return time and time again to the same navigators organizations. The organizations sisters often work at, they also deliver other essential social services to their communities. So for example, they might help with food or housing assistance. So they're really meeting community members where they are. And at the end of the webinar, the foundation will share some links of where folks can find enrollment assistance in their area. No, perfect. Next slide, please. Thank you. So now when millions of New Yorkers will need to take action to ensure they remain insured, assisters will be playing a critical role in this whole effort. So why Keep New York Covered? The Navigator and facilitated enrollment for the aged, blind, and disabled contracts does not fund outreach and marketing. Rather, they fund direct enrollment activities. So this is where the Keep New York Covered project comes in, as we fund the outreach and marketing efforts for those CBOs to market their services in their respective communities. The Keep New York Covered project is building off of the lessons of the Reaching the 5% project. This project was influenced by the research done by the United Hospital Fund and the Health Foundation of Western and Central New York. CSS had this pilot project funded by Mother Cabrini and the Health Foundation of Western and Central New York. CBOs were selected in Western and Central New York for them to target the uninsured in their areas and promote their enrollment services in the areas they're serving. So this pilot project, it ran from 2020 to 2023. It built off of CSS hubs and spokes model. In this model, CSS works as the hub. So we provide the funding, we do the technical assistance, quality assurance. We also host network meetings and also do the reporting with our funders. And then the spokes are the CBOs we partner with that do the work in their respective communities. In this pilot project, the CBOs reached over 9 million New Yorkers and enrolled over 7,000. And the return for investment was 863%. This is based on the savings you get from having someone be insured versus someone not insured. And after a successful Reaching the 5% project, the Keep New York Covered project came to be. Next slide, please. So here's a list of the Keep New York Covered funders. We're extremely grateful to be working with all of them on this very important task ahead. Next slide, please. So what is the Keep New York Covered project specifically? It's an initiative. We're offering $20,000 to $50,000 grants to enrollers for marketing and outreach work. So in November of last year, we issued an RFP to 111 eligible CBOs enrollment groups. We received 46 applications. We were really excited for that. It really showed the importance of the work and everything that needs to be done. We selected 28 CBOs and we had our kickoff meeting this past March. The Keep New York Covered project is using a CSS hub and spokes model. So as the hub, we're providing the funding, the quality assurance, technical assistance. We're doing regular interactive learning sessions with our CBOs, and we're also assisting them with the marketing messages, the outreach strategies, and we're also doing the reporting. And then between February and April, we partnered with iCore Strategies. They're a Black-owned consulting firm in Brooklyn, who has also been partnering with the New York State of Health on their communications campaign. The iCore team, they trained and hosted office hours for our subgrantees on how to enhance the impact of their organization's outreach approach. That was really helpful. And then in addition to that, we've been in close coordination of messaging with marketplace officials. Next slide, please. So here we have the Keep New York Covered map. Our CBOs are covering 52 counties. The 10 counties that do not have coverage are for lack of proposals and resources. We have 14 CBOs upstate and 14 downstate, which is consistent with how the state population is allocated. Next slide. So I just want to share a little bit about the network's current and future impact. In just 2 months, our CBOs have reached over 1.9 million New Yorkers through outreach, and they've enrolled almost 4,000 individuals thus far. Down here is a couple of outreach activities our CBOs are currently doing and will continue to do, and also many other strategies, but these just to name a few. They've been partnering with their own networks and coalitions. So they've been sending out email blasts to their clientels and also their CBOs, partners clientele. Some of them are doing social media posts. Some will be doing live through like Instagram and Facebook. Many are doing print media and radio ads, also hosting virtual and in-person community presentations. They've done a lot of unique in-person outreach. So they've been to libraries, medical facilities, delis. They've been to elected officials' office, tenant rights workshops, museums, you name it. They're pretty much meeting community members just where they are. And also some of them are doing phone banking and press release for their local networks. Next slide, please. And here I just wanted to share a few of the outreach activities the network has done so far. So to the left, we have earned media from a CBO in the southern tier. The top two are social media posts, CBO in Long Island launched, and also CBO in the city. The middle one is a web landing page one of our Bronx CBOs is doing in Spanish for their clients to connect with one of the navigators. The pictures to the right are from a partner in Brooklyn that attended a resource fair, and then the bottom one is a billboard up in the Hudson Valley. And now I'll pass it on to Juan from Emerald Isle Immigration Center, which is one of Keep New York Covered CBOs. He'll share more about the community and on-the-ground perspective. Thank you.
Thank you, Sarah. Thank you, Avital. Thank you, Danielle, and thank you, Marcy, for the opportunity. So my name is Juan Carlos Grajeda, and I work at the Emerald Isle Immigration Center in the healthcare assistance programs, including the CSS Navigator program, as well as the Keep New York Covered program. And I've been with Emerald Isle for almost 10 years. So the Emerald Isle Immigration Center, also known as EIIC, is a 35-year-old not-for-profit organization that provides immigration and social services, including access to healthcare. And we are located in New York City, in Woodside, in Queens, and in Woodlawn in the Bronx. So I am going to highlight some of the public education and outreach strategies that we have been implementing at Emerald Isle. So as you can see on the slide, we are conducting online community presentations and workshops in collaboration with our education and citizen assistance programs. Through these presentations, we are able to reach many students, particularly individuals looking to become US citizens and their families. And many of them are currently enrolled in Medicaid, as well as the Essential Plan. So this is an online presentation, what you see on the screen of an online presentation that we conducted recently for our citizenship classes. So next slide, please. So another outreach strategy that we are implementing now is partnering with our EIIC creatives team members. So basically, they're a group of accomplished artists that basically lend their instrumental music, songs, visual arts, and filmmaking repertoire to outreach events to raise awareness about the social services and programs of Emerald Isle. So the team is committed to producing and performing at concerts, art workshops, educational classes, parties to seniors, and outdoor events. Next slide, please. So this is an example of an outreach activity during a painting stories workshop that took place at 34th Avenue Open Street in Jackson Heights, Queens. It was accompanied by an acoustic music lesson, a session by our EIIC creatives teams as well. Next slide, please. So this is another example to highlight. It's our volunteers and artists call to action to support our access to healthcare outreach efforts during a celebration event at the New York Historical Society a couple of weeks ago. So as you can see, our volunteers and EISC creatives, team members joining forces. Next slide, please. Also, we strongly believe in the power of collaboration and its effect in our local communities, particularly our immigrant communities. So one important aspect of the effectiveness of our outreach efforts we conduct in the Bronx and in Queens has been basically meeting individuals and families in places where they normally gather and where they get reliable information. So our outreach efforts have focused primarily on working closely with local churches, houses of worship, local parks, community centers, schools, public libraries, parent-teacher associations, and consulates in the New York City area. Next slide, please. So as you can see in this slide, our EIAC Creative Things is bringing a world music session and healthcare education materials to a local school. Next slide, please. So another outreach strategy that we will be implementing in the coming months will be participating in a community event called Health Window, or Ventana de Salud in Spanish, that takes place at the Colombian Consulate in New York City, where we'll have the opportunity to speak in Spanish to many individuals of Colombia origin, many of them residing in the Bronx and in Queens. The General Council of Colombia has been very grateful with Emerald Isle for supporting this event and informing their community regarding important changes affecting Medicaid, Child Health Plus, and the Essential Class enrollees, as well as our healthcare enrollment services. Next slide, please. And finally, social media promotion. We utilize our Facebook and Twitter accounts. We're also incorporating Instagram, and as well as our organization website, newsletter, to promote the unwinding. In addition, we will be introducing a social media ambassador program, which will engage local community leaders and members regarding social media posting, as well as hosting social media events to help extend our community reach. So next slide. So thank you very much for the opportunity. Thank you, Avital.
Thank you. So I'm going to stop sharing. Thanks to everyone. This was so helpful. I mean, I think what we see here from all of your presentations is the range of solutions that we need to reach New Yorkers, everything from large-scale administrative renewals to reaching people in communities at community events. And so I really appreciate you all highlighting really the scale of effort that needs to happen here, from community to technology solutions. So we'll open it up for questions now. There's been some in the chat, and so I'll try to get to some of those, and then feel free to add others as we go along. I think one of the first ones, there were a few kind of technical questions, Marcy and Danielle, about some of the guidance around the non-Magi population. And there was, for example, one question in the HRA bucket was, will consumers of any kind with SSI income be administratively renewed? Since some of them already are. Is there any guidance on that?
So let me take that one to say that I'm definitely not the non-Magi expert, and I don't want to misspeak on this. I will follow up afterwards with the specifics. I think another related question on all of the E14s is when we'll be issuing formal guidance. So Lisa Sprana has indicated that will be going out. We're waiting for written. We don't have all of the written approvals. We've received oral approval for some of them. And so as soon as they're all in, we do intend to post them and share them with folks. So I know
Great.
it's late, but we're sharing what we can based on what we know from verbal approvals.
Great. Okay. Yeah. So that covered a few of the other questions in there about guidance. So that's great. Thank you. And then one of the other kind of just detailed questions was, will those the dashboards be publicly available, or are those more for internal use by the health department?
So the dashboards are largely going to be internal, operational, for our own tracking and figuring out how to redeploy efforts. But we're definitely planning to release data, but I think it won't be at the same level of detail on those dashboards. And happy to talk about what more can be done, but we will be sharing first the baseline and the first renewal cohort. And so some of that is still being finalized, but we absolutely intend to share data. We know how much interest there is.
Great. And then one last question about coverage, because there was there's a few questions about the over 65 population. One, I think, is specifically about the coverage of through the waiver, and then there's a specific question about whether people can enroll through the New York State of Health marketplace if they've just turned 65. So one is about the waiver coverage, and the other is about more of the technicality of who can enroll where.
So this is focused on renewals. So people who, basically, aged out of what would normally be permitted to enroll through New York State of Health. We got permission to renew that cohort of existing enrollees and keep them within New York State of Health, whereas under normal rules, we would have moved them to the districts. So that's what that is specific to. And I think based on a quick read of the question that came in, I may not have been enormously clear, but it is, it is specific to Medicaid. I don't know if I misspoke, but.
Okay, great. Thank you. And then I think one of the other questions, just in terms of outreach, is, and this might be for Sarah and Juan, you spoke of some really great examples of what's happening throughout the state. I know that the Keep New York Covered initiative and the Navigator network writ large has a lot of groups that are maybe in more rural areas. We talked a little bit about some more urban solutions. Can you just give some examples of what might be some differences in terms of outreach efforts that might be happening in a more rural community?
Yeah, definitely. I can take that. So our CBOs upstate, of course, they have some limitations reaching out to consumers. So one, they're being very creative of where to do outreach at. They've been going to post offices, schools, malls, YMCA, places like that. Also, something that's been effective is just advertising their services in public transportation and using local print media. But I think of one of our partners, actually a few of them upstate, they're actually partnering with provider offices, which are also trusted community members. They've drafted letters for these provider offices to send out to their patients enrolled in Medicaid, EP, and Child Health Plus. So it's coming from the provider's office, which is a higher chance that the consumer will actually open the letter, et cetera. And these letters are very informative. They outline the end of the continuous coverage. They tell consumers to be in the lookout for LDSS notices and marketplace notices, and also informing them of the CBO's enrollment services they need assistance with the renewal process. So those are some of the things that upstate CBOs are doing.
Great. And Juan, I don't know if you have anything to add, maybe even just touching on some of the language access needs, for example.
Sure. So basically, language access is a very important aspect in our outreach efforts. So most of our outreach campaigns are conducted in both Spanish and English. We make sure that we distribute materials in different languages depending on the neighborhoods in New York City where we are conducting the outreach activities. So we at Emerald Isle, we speak several languages, such Spanish, Portuguese, French, and Italian. So in addition, we also address the needs for interpretation of new concepts, not only related to access to healthcare, but also regarding health and wellness.
Great. And I imagine Danielle, Marcy, and Sarah, across the Navigator and CAC network, there is probably, I don't know the number of languages represented, but I imagine it's a lot.
Yeah, and I don't have it handy. Marcy, you may. I can say our materials are in 14 languages, including English, and the enrollment assisters, I think the last time I knew, it was like 48 languages or something of that nature. And our customer service center can accommodate all languages.
Great. And then I think one of the things we've talked a lot about, how many people we need to reach to renew their eligibility and re-enroll them. What's your expectation around people that might not remain eligible for some sort of coverage? Do you have some scale there in terms of what the expectation will be?
So we will, I think we shared some of this coverage transition data at the United Hospital Fund meeting, and it's still online. Very large number of our enrollees will remain eligible for coverage that they're in. The next subset will, we think, move within marketplace programs, so we'll transition them. There is a large share who we expect will move to employer-sponsored coverage, and so there's a whole effort engaging with employers to make sure they are aware of timelines and things of that nature. And we do unfortunately expect a small number. The estimate was 100,000 could become uninsured as a result of all of this. But our goal is, to do everything we can to keep people enrolled in a source of coverage and, move them to what they're now eligible for.
Great, thanks. And I think one of the other questions, just in terms of this, might also hit on a question in the chat about the coverage for the 65 plus undocumented population. But I know the recent state budget just passed, and we thought maybe you could provide just a little bit of an update on whether there was some support for the enrollment network, and that might also allow you to just touch on the 65 plus population.
Sure. And let me actually, Alicia is texting me that I misspoke on the languages, so I'll just correct myself. So enrollment assisters speak more than 58 languages, navigators more than 38. So
nice.
Thank you, Alicia. So on the New York State budget, we did push for funding around all this enrollment assistance, and we're pleased to say that two big buckets of money were included in New York State of Health's enacted budget. It includes $3.5 million for the Community Health Advocates Program, which, as we're talking about today, is so important. The legislature puts money into that program as well every year. And then the other piece that was a big increase relates to the facilitated enroller program serving the aged, blind, and disabled. The budget includes an $8 million annual increase to that program, given the needs, the complexity of the application for that population, and that I think will be much needed funding going to those folks. So more to come, and this all falls under Gabrielle Armenia, and there's a lot of work to be done to get the contracts updated. But the good news is the funding is there.
Great. And then one of the other questions is, I think this might be something that maybe we can funnel offline around the specifics around the E14 waiver for maintaining enrollment for dual eligibles in the New York State of Health marketplace. One of the questions, there's a few different questions, but one of them being, will those people be administratively renewed? And I'm not sure if that's something that you can answer.
So will they be without having to take an action? I honestly, I don't want to misspeak.
Yeah.
The part that I know I can answer is that the goal is to keep them in New York State of Health and not, go back to the districts. So that piece I know, and we can follow up on the, to the degree it can be administratively renewed.
Great. Okay, that's great. And then another question came in about the special enrollment period, but maybe you can make the distinction here for us about like the special enrollment period that we all know about, the open enrollment period, and how this interacts with that, because I think that there's probably the question is based on that distinction between all the enrollment periods.
Yeah. So all the programs that operate on New York State of Health, only the Qualified Health Plan program operates under an open enrollment period, a 3-month open enrollment period. During the pandemic, we have extended a special enrollment period so that everybody, no matter what they're eligible for, had the opportunity to enroll in coverage. We are continuing that special enrollment period for the duration, and it's under the authority of extenuating circumstances. That'll go through the end of the unwind period. So through May of 2024, all of the programs that New York State of Health operates, Medicaid, Essential Plan, Child Health Plus, and Qualified Health Plans will be open for enrollment so that we can successfully do this unwind and move people. No channel is closed per se.
Got it. Okay, that's helpful. And then I think, one of the other things that it sounds like from all of your timelines and the various things that all of the presenters shared, notices are landing in people's inboxes or have started to. I'm curious if there's, even some early lessons learned from across the group about where there's like most confusion or, from the state perspective, are you finding that a lot of the kind of returned mail in terms of people moving? Is there any early lessons learned from that initial tranche of people who are receiving notices?
I think for New York State of Health, it's too early to answer
Yeah.
that. They literally just started going out.
Yeah.
But if others have lessons they want to chime in on.
I don't know if Sarah, Juan, if there's particular things you're hearing, even if it's more anecdotal from some of the residents and community members about the things that are tripping them up the most.
So I have not heard anything specific about notices, but we did hear about our CBOs of getting calls from health insurance, the state, and also then the CBO about that they'll need to renew their coverage soon. And they expressed, a bit of worriedness of the amount of calls they were getting. So they're like mitigating that as well. And just reinforcing it's like, okay, yeah, you need to renew, you can come to us, you can go to the state and they'll definitely help you.
Great. Juan, I don't know if you have anything to add there.
So what I have heard so far is from clients that I have helped in the past. So basically, they're hearing about the news, the ads on TV and the subways, so like to make sure your information is updated. So look out for the notices. So the message is for them to keep their information up to date. So when they receive the notices, they go to the right place. So right now, that's the important message that we tell them. So just make sure your information is up to date, whether it's your mailing address, your email, your phone number, everything has to be up to date so that when New York State of Health starts sending notices, which is happening already, they get to the right place. Yeah.
That's great. And I'll say that we did hear from our customer service center that we are starting to see an uptick in calls with people, just to your point, Juan, coming to update their contact information. We do want to reiterate the part about, what's in the notices is telling people actions they need to take, if any, to renew their coverage. And Marcy and team have developed one of those how-to videos around how to find your coverage end date, because we don't want, not everybody has to come in right now. So we don't want people to panic unnecessarily. So try to make that very easy for them, and enrollment assisters know how to find that, as do the local district offices, so people can get that question answered and know when they should expect to be hearing from us on renewal.
Absolutely, you're right. That's a really good point. We're doing this big push in terms of communication, but since it's a rolling basis, we don't want to cause too much panic. So that's helpful. So we're wrapping up. We're heading towards the end of time. I don't know is there anything else from the panelists that you want to make sure that you didn't get a chance to share that you'd like to, or I'll just wrap us up and make sure everyone knows where to go next for information. Great. Okay, so I just want to share, with everyone in the webinar, we've kind of put this in the chat throughout. We will be sharing all these materials. There's lots of links, as you saw, to great information. I really recommend checking out the assister list, of course, to see where the assisters are in your community. The Marcy's PHE Wind Down Toolkit has a whole range of awesome tools, including regional and county level descriptions of what's happening in terms of the level of enrollment in each county and who needs to be reached. So there's a lot to dig into. And so I really encourage everyone to do that. We will make sure you have those things in hand. And we'll also go through the chat and make sure those questions get back to the state and to our CBO partners if there's things that we can answer after this session. But I really appreciate everyone joining us today. We had such a great turnout, which really does make us feel, heartened that we are all in this together to make sure that New Yorkers remain covered. And so I appreciate your time, and everyone have a great afternoon. And thanks so much to our panelists.
Thank you.
Thank you.
Thank you.